Hello guys, welcome back once again to my YouTube channel. This is Prasanna Kabra. I am a third year MBBS student at Government Medical College and Hospital Latur, Maharashtra. In this video, we will discuss very important topic from anatomy, and the topic is lymphatics of breast. This topic has a lot of application in surgery. So it is highly and very important topic. So let us begin with the lymphatics of breast. Now breast lymphatics, as you can see, is divided into two groups of lymph node. The first is axillary group of lymph node, which is responsible for 80 to 85% of the drainage. The second group is internal mammary group, which is responsible for 10 to 15% of the drainage. Now, what the thing is, what exactly you need to remember is locations of this group of lymph nodes. Now, internal mammary group of lymph nodes, they lie along the lateral border of the sternum. So as you can see in this image, this is sternum, this is the lateral border of the sternum. The internal mammary group of lymph nodes lie along the lateral border of the sternum. Okay. Now the next group, which is the axillary group of lymph nodes, which is responsible for 80 to 85% of the drainage, it is further divided into various groups. Now in this, the first group is central group of lymph node, which lies deep inside the axillary group. Second is apical group, which lies in infraclavicular region on the medial aspect. Now you can see this. This is the diagram. This is the central group of lymph node which lie inside the axillary group. And the second is subclavicular group of lymph nodes which lie below the clavicle on the medial aspect. This is the subclavicular group of lymph node. Now the third is lateral group of lymph node which lies along the axillary vein. So lateral group of lymph node will lie along the axillary vein. Fourth is posterior group, which is also called as subscapular group of lymph nodes. It lies along the anterior border of latissimus dorsi muscle. So you know muscles of the back, the muscle is latissimus dorsi. On the anterior border of this latissimus dorsi, the posterior group of lymph nodes are located. Fifth is anterior group of lymph nodes, which is also called as pectoral group, or which is also called as external mammary. Now see the difference, internal mammary and here is the external mammary. External mammary, which is also called as anterior group of lymph node, it lies along the lateral border of the pectoralis major muscle. Okay. Now very important point to remember here is anterior group of lymph node is the most common sentinel group for breast cancers. Now what do you mean by this? See, I have written it over here. Basically, cancer can spread to various locations and the process is called as metastasis. So metastasis can occur via various routes. The first is lymphatics, which is most common route. Second is hematogenous, which means via the blood, and it can also spread directly. So the first lymph node to drain the tumor cells via lymphatics is called as sentinel lymph node. Now you can understand, if the tumor occurs in the breast, the first group of lymph node, which is called as sentinel group of lymph nodes. So the sentinel group, most common sentinel group for breast cancers, it is anterior group of lymph node. Okay. Sixth is Rotter's lymph node, which is also called as interpectoral group of lymph node. Now interpectoral, you can understand, it lies between pectoralis major and pectoralis minor muscle. So this is the diagram. You can see various locations, and this diagram is very important. You can understand various type of locations by looking at this diagram. Now up till now what we have done is we have divided breast lymphatics on the basis of anatomy. Now from the surgeon's perspective, we divide breast lymphatics into various levels. Now why do we divide? I have written it over here so that we can do a precise and well-oriented surgical dissection. Okay, so for surgery purpose, we divide breast lymphatics into various levels. First is level 1, level 2, level 3. Now on what basis we have divided these levels? On the basis of this muscle. The muscle is pectoralis minor muscle. Now level 1 means what? If the group of lymph nodes lie to the lateral and below the pectoralis minor muscle. Lateral and below. Okay, so lateral means where? Lateral means here, and below, this is the level 1. Now second is at the level of pectoralis minor, which means here, and the third is level 3, which is medial and above the pectoralis minor. So I will write it over here. See, this is the level, I'm so sorry. This is the level 1. This is the level 2. And this is the level 3. Now for convenience purpose, we have divided breast lymphatics into various levels. Okay, so level 1 lies lateral and below the pectoralis minor, level 2 at the level of pectoralis minor, level 3 medial and above the pectoralis minor muscle. Now, which group of lymph nodes are included in level 1? Anterior, posterior and lateral group. In level 2, we include central and rotus lymph node. In level 3, we include apical infraclavicular group of lymph nodes. Now, this